The science behind morning erections. What they really mean? Have you ever wondered if waking up with an erection is normal and how often it should happen? This is a question that has sparked curiosity after Dr. Anna Good. It's a topic that touches on male physiology and overall health, and understanding the science behind it can offer a deeper insight into one's own well-being. The conversation begins with a fundamental question. What exactly causes these morning erections? And are they simply a result of erotic dreams? The physiology of nocturnal erections. The common belief that morning erections are a direct result of sexual dreams is a misconception. These erections are a normal and involuntary part of male physiology, medically known as nocturnal penile tumescence. This phenomenon is closely tied to REM sleep, the stage of sleep where most dreaming occurs. Since REM sleep typically happens in the early morning hours, it makes sense that men often wake up with an erection or experience one right after this stage of sleep. This is a natural process that has been observed and studied for decades. But what is considered a normal frequency and duration, especially beyond the teenage years? To answer this, researchers conducted a groundbreaking study in 1975 that included 125 healthy boys and men, ranging from 3 to 79 years of age. Participants spent 3 nights in a sleep lab, where machines meticulously measured brain waves, eye movements, and changes in penile size. The study focused on the middle night to get the most accurate data, and all subjects were healthy, without sleep problems, erectile issues, or medications that could affect the results. This study established a baseline for what is considered normal in healthy individuals. The results were surprising and provided a clear picture of how these nocturnal events change throughout a man's life. A lifelong phenomenon. Erections across the ages. From early childhood, specifically ages 3 to 9, erections during sleep are a consistent part of development. The peak, however, occurs during the preteen and teenage years, when erections are at their most frequent and longest duration during sleep. During the early teens, an erection episode can last for an average of 40 minutes, accounting for a remarkable 40% of the total sleep time. After puberty, this average duration begins to decrease, leveling off at about 20% of total sleep time, which translates to roughly 1.5 hours per night. The average adult will experience 3 to 5 episodes of nocturnal penile tumescence, with each lasting approximately 30 minutes. Interestingly, some might assume that less REM sleep in adulthood is the reason for this decline, but that's not the case. REM sleep remains relatively consistent after the teenage years, with most adults getting about 100 minutes of REM sleep per night. A more recent study using a specialized device confirmed these findings, recruiting 40 healthy, sexually active men between 20 and 60 years of age. The study found that erections occurred in every single age group, demonstrating that this is a lifelong phenomenon. However, a key difference was noted. The amount of blood flow to the erections decreased with age. While men in their 20s saw an average increase in blood flow of 268%, men in their 50s experienced an increase of about 200%. Though the blood flow was slightly reduced, it was still robust, and the number and duration of erection episodes remained consistent across the age groups. These findings have been replicated in other studies, providing a solid foundation for understanding what a healthy man can expect. The meaning behind the morning erection. So what does all this data really mean? The bottom line is that a man should be experiencing morning or nighttime erections well into his later years. While they may not be as frequent or as long-lasting as they were during his teenage years, their consistent presence is a significant indicator of health. When a man has good nocturnal erections, it signals that several crucial systems in his body are functioning properly. It's a sign of good blood flow, healthy hormonal balance, and intact nervous function, all of which are essential for blood to reach the penis. A noticeable decline or complete absence of these erections is a signal that something may be wrong. This can manifest as changes in daytime erections or other symptoms of conditions like low testosterone. A man who notices these changes should consider getting his testosterone levels checked as a drop in this hormone is often linked to the first disappearance of nocturnal erections. It's also an opportunity to take a holistic look at overall health. Optimizing blood flow and hormonal health through a healthy lifestyle is a critical step. This includes maintaining a healthy weight, incorporating both resistance training and aerobic exercise into a weekly routine, and prioritizing stress reduction and quality sleep. Ultimately, morning erections serve as a valuable biomarker of overall health. Their decline is a call to action, an opportunity to address potential issues before they escalate into more serious problems like erectile dysfunction. It's the body's way of communicating what's happening internally, providing an early warning sign that something needs attention. If you find this content useful and want to stay informed about the latest in men's and women's urology, Dr. Good's newsletter provides valuable insights. It features new research, answers subscriber questions, and offers updates on her work, all for free. This is a great way to stay ahead of health issues and proactively take charge of your well-being. As always, remember to take care of yourself because you are worth it.